Yeah, I've seen through a lot of my clients, some of them start with just one drop of the 2%, which I think is like 1 milligram, like you said. And a lot of my clients see improvements very quickly at just because a lot of my clients have hypothyroid. And, we all know that basically T4 is made with protein and iodine. Um, if you can kind of talk a little bit about that and just what you've seen with maybe healing with the thyroid in terms of supplementing with iodine.
Okay. A large percentage of our patients are really subclinical hypothyroid. So a little iodine bump will do a lot to bring them into the normal range. There are some patients that are a little more fragile, and not everybody is able to get off their Synthroid or T4 type medicines. So there's always, individual variation, but most of the time people can either get off their thyroid medicine or reduce the amount they're taking. And that's kind of one of the hallmarks of the therapy. Once somebody starts on iodine, if they are on thyroid hormone, if they start getting side effects from the increasing dose of iodine, and most predominantly it's rapid heartbeat, reducing the amount of thyroid hormone that is taken is the proper therapy. And so it's important for the patient to work with their healthcare provider or whoever they're getting their T4 from, just so they're aware that the dosage may have to be reduced.
So just playing devil's advocate, if I was, a patient and I was taking Synthroid or T4, any T4 kind of medication, and then I get on iodine and I realize I feel better, but then I started, getting these symptoms. And then I go to my doctor who put me on the T4 and says, what are you doing with the iodine? That's dangerous and that I shouldn't. So how do then I marry that to, you know what I mean? So to get my practitioner to go, okay, actually, maybe you do need less T4 and okay, maybe the iodine's working. I mean, it seems because if old tricks are hard to change, how do you get someone that's still in the old kind of paradigm to adopt my new ways? Does that make sense?
Yes, that can be a very tough issue. Sometimes it's easier to change practitioners. To really tell the honest truth, but a lot of doctors are open to this type of therapy. Okay. And I think there again, going to our website under the research section, and there's an article that is titled "The Use of Iodine in the Medical Practice," and it's a great literature review, and it basically goes over why iodine is important and how much to use.
Okay. Yeah, that's really powerful.
That would be a great place to start, I think.
Okay. And yeah, and I think the more that we are educated and understand some of the science, the literature out there, then we can, I guess, make a better argument to some of the doctors. It's just, I haven't personally found many doctors myself that support the excess use of iodine. I've actually seen a lot in even the public social media space where a lot of thyroid doctors are like, you want to be careful with the iodine. And so, yeah, I think I think it makes sense to change practitioners, but I wonder, like how many doctors are there that are actually offering the Synthroid and stuff. But yeah, I'm sure.
That's the problem, is to find an alternative medicine or an open-minded physician that'll work with you. But I think that, even a traditional doc, have them do T3 and T4 blood levels and just see where you are. And that brings up the issue of rising TSH levels that some doctors will look at and hit the panic button, and not realizing that during iodine therapy, in order to get iodine absorbed over the cell wall, you need a substance called symporter. And symporter is what actually transports iodine across the cell. The only way to stimulate production of symporter is with TSH. Mm. So TSH levels will go up, not everybody, but in a considerable proportion of the patients, and it will go up very high. Normal levels are in the single digit. We've seen TSHs go, 100 to 200.
Wow. Go ahead.
Which, really, if that was a true number, you probably would not be able to get out of bed. You'd be so fatigued. And most people that are having this symporter effect say, I don't feel anything different. So we know that it is this stimulation of symporter by TSH.
That makes sense. So how long after do you think, have you noticed that the TSH kind of normalizes where maybe it's not as high and that, our doctors or whoever's running the test don't have to be as alarmed?
3 to 4 months.
Okay. Yeah,
But we've had patients that have gone 2 years with high TSH levels.
Okay. So would you base it more on the symptoms and that rather than just the TSH then?
Yes, symptoms and lab results of the T3, T4.
Right. Okay. Yeah, I had a doctor, an MD that, she's more holistic health, and we were talking, and she says she believes in iodine, but she gets really nervous because the TSH skyrockets, and then she, feels like it's a medical liability for having some people around. But I think this will be really helpful information for her. So thank you for that. So have you seen a lot of people with, maybe even if it's kind of undiagnosed thyroid imbalances or just hypothyroid, that were able to get off some of the medication, and not just the T4 medication, but in general, just even the T4 plus T3 medications, once they start really supplementing iodine and maybe even changing their diet?
Yes.
Okay.
And that's kind of an individual thing. And I guess it depends on what conditions they're being treated for. But we have had reports of people being able to reduce doses of, other types of medicines in addition to their thyroid medicine.
Okay.